It's live now.
Okay. Good afternoon, everyone. My name is Aklima Bibi, and this show is called Aklima Bibi with NL24. I'm hoping to highlight various issues that affects us all, or many of us in our communities, in the hope of educating, inspiring, and empowering. Today's topic is called "Blame the BAME," and it's in relation to a report by Public Health England published June 20, Beyond the Data, Understanding the Impact of COVID-19 on the BAME Groups. The discussion will be to see if this report justifies the findings by the Public Health England that has been widely used by the mainstream media, or has this report has had a greater negative impact on the BAME community as the blame the BAME for the spread of COVID-19. To discuss these issues and go deeper into this issue, I'd like to welcome our special guests. First of all, Dr. Musharraf Hussain from Rochdale, retired GP. Also, Ishtiaq Ahmed, former councillor and a manager for Sharing Voices, and Rejan Ali Abedin, who is a parent and a legal assistant. We were hoping to be joined by one more guest, but she's having technical issues. So hopefully she will join us as soon as she can. But to our special guest, thank you very much for joining me. Thank you.
Thank you for having us. You're welcome.
Thank you. My first question is to Dr. Musharraf. How much do you know about this report by Public Health England that states that the BAME group are at a greater risk from COVID-19 than their white counterparts? And what is your view? That question is to Dr. Musharraf.
Thank you. I have looked at the report, and it is true that BAME community has suffered more than any other community in UK when it started, particularly in London area, when it was in the peak. Many of our community, young and old, got infected, and unfortunately, a lot of them passed away. And majority of them were probably frontline workers. If you look at the BAME community, they are more, if you look at the population and the representation in the sectors like hospital, care worker, transportation, so all the face-to-face, public-facing jobs, they are involved. So they're frontline workers and public-facing workers. So they have all, obviously, in the initial stage, there was not much protection. People didn't know about this illness, and many of them got infected and obviously carried it to their families, and it spread. And so I think we suffered, but it was not directly to blame the BAME, because they were in those situations because of their jobs and particular employment risk they took. Having said that, we are also a community where there are certain health issues, there are certain socio-economic issues, and the family bonding and multi-generational family households. These are also true. Where we know if you have a chronic illness like diabetes, heart disease, lung problems, you are going to be affected more with this virus. And if you're in a multi-generational household, the young people who will be asymptomatic may pass it on to the older generation without knowing. So that has happened, and there is a direct correlation between socioeconomic conditions and the effect of this illness. And it is not of BAME communities making, it is what it is.
Okay. However, my question again is to you, Dr. Musharraf, is like you were saying, obviously we have that there are various reasons why it's affecting COVID-19 is affecting the BAME community. But is it COVID-19 or other issues that are affecting, which doesn't, I mean, I'm not sure whether it actually justifies the report. Do you think it justifies the report saying that the BAME community are suffering more? Is it the COVID-19 they're suffering or other issues that they're suffering? Should that have been brought in that report?
I think, yes, it should. It has exposed that
Okay.
the BAME community has been underprivileged
Okay.
in obtaining healthcare in the socio-economic ladder, etc. Because they are neglected. They are a community who does not always get the right treatment at the right time.
Okay.
Partly, maybe some hesitation because of the system, the language barrier, cultural barrier. But on the other side,
Okay.
the services are not very user friendly for this group of people as well. They have come a long way, but if you look back 20, 30 years,
Hmm.
what it was, you
Okay.
have signs in our different languages, etc. But
Okay.
beyond that, people's attitude, the service providers attitude, understanding, the patience with these people are probably not it should be. So the community was suffering from different chronic illnesses. We know in South Asians there is increased incidence of diabetes.
Hmm.
It is a known fact.
Okay.
But how much effort has been put to actually provide services to these group of people, which is culturally and religiously sensitive.
Okay.
So it has exposed all these inadequacies in
Okay.
the system, and
Okay.
we have been suffering for many, many years. And now, hopefully, at least thanks to the COVID-19,
Hmm.
it has been exposed, and we hope the authorities will take some action and correct. But it has not been, as you say, explicitly admitted in these reports, but they
Okay.
never do that.
Okay. Mr. Ahmed, what's your view on it?
Well, the question of why more people from
Mm,
BAME backgrounds appear to be at greater risk of dying of COVID-19 is one of the most urgent of the epidemic. So there is little doubt about the raw numbers, uh, and major studies by the ONS, the Institute for Fiscal Studies, and Public Health England have found significantly higher mortality rates amongst the BAME populations. So the question is, why are BAME people more at risk? So no one knows the answer for sure, but there are a number of plausible explanations. Um, so, if the real risk factor is exposure to infection in the first place, it may be that we need to look at the differences in occupations between different ethnic groups, as has Dr. Hussain just pointed out. And the ONS, the Office of National Statistics, say that some ethnic groups may be overrepresented in public facing occupations and may therefore be more likely to be infected by COVID-19. I mean, for example,
mm,
individuals in the Bangladeshi and Pakistani ethnic groups are much more likely to work, perhaps as transport operatives, than
okay.
those in any other group. And the
Mm,
paper also points out that some ethnic groups may be overrepresented in health and social care, which may carry greater risk of exposure to the virus.
okay.
It also notes that the demographic profile of the COVID-19 victims was likely to change as deaths in hospitals dropped, but remained high in residential care homes where the population is overwhelmingly white.
Mm,
So, Public Health England says BAME people may be more likely to be infected because they are more likely to have higher risk jobs and to live in deprived areas and overcrowded households.
okay.
Now, in line with other studies, the Public Health England report says increased risk of dying could be driven by high rates of underlying illnesses like cardiovascular diseases and diabetes.
Okay.
However, some critics said the report should have gone further, really in investigating the possible role of structural inequality in increased mortality amongst ethnic communities. I mean, I think minority people, in particular those from Black, Bangladeshi, or Pakistani backgrounds, have perhaps for decades been more likely to have lower paid jobs, leaving them with less money to have healthy lifestyles.
Okay.
And they're more likely to have conditions, as I mentioned before, heart disease, type 2 diabetes, etc., and more likely to work in risky jobs in which they spend time in contact with much more members of public, therefore increasing the chance of them catching the disease. So for many BAME communities also, and as I think Dr. Hussain pointed out earlier on, was a real lack of trust for the BAME communities in NHS services, and therefore treatment kind of resulted in their reluctance to seek care on a timely basis. Again, resulting in late presentation with certain diseases. Others perhaps are just fearful of being, fear of services, right? Yeah. So what this essentially does, it shines a light on how discrimination and structural racism have been a root cause behind the disproportionate impact of COVID-19 on BAME communities.
Okay.
And we have to remember that COVID-19 pandemic had not created inequalities out of nowhere, but actually exposed existing ones and brought them to a head in Britain's death rates.
Right. Okay. But one of the issues that I'm kind of like, and I might actually ask Rajan on this question, is the report or the various news articles states white counterparts, BAME and white. How, they've done their research, or it seems they've done their research. What research and conclusion have they come with from their white counterparts? I mean, I find it, in my opinion, is quite discriminatory. I'm going to ask Rajan on that question. What's your view on that one?
So for me personally, I mean, when you look at the report and you read the report, yes, there is structural racism, there is occupational hazard, but for me personally, it's not directly connected to COVID-19. Now, what I found is health issues, living conditions, does not really play a factor. I mean, if you look at the statistics in, for example, Bangladesh, Bangladesh have found 333,000 cases, and it's 4,634 deaths. In UK, there is 355,000 cases, recorded cases, and the deaths are 41,594 deaths. Now, we are a small minority in this country. So for us to be in this category that are high risk, I find unjustified. I mean, even Pakistan have been reported 300,000 cases, but deaths is 6,365 deaths. Now, even with India have got the highest recorded cases that I found is 4.5 million recorded cases and 75,000 deaths. Now, what I'm trying to understand is, if we are at more of a high risk, like they say in the report, that Bangladeshi individuals are twice as highly likely to die from coronavirus. Now, if you look at other countries who have got much poorer structure, much poorer background, they have somehow kept the deaths to a minimum. So what I'm trying to understand is, I don't feel it's necessarily got to do with the BAME. I feel that it is more the government's failing on understanding the virus and handling the virus. Now, if they acted on when the virus first came about, we may have had, I can almost guarantee we would have less deaths. But they chose to keep the economy running and hesitated on handling the virus. Now, I'm sure I think the government have some sort of precaution in terms of deadly viruses. Now, they chose not to act on it. So I don't feel like it's anything got to do with the BAME community. I don't feel like it's got to do with anyone on the front line. I feel like it is the government who have failed the people in handling the virus. I mean, if doctor, I'm sure you can agree with me on this basis. What would be your opinion on this as an expert in this?
Yeah, I was going to come to you, Dr. Musharraf. What's
Yes, I think what Rajan says is right. If you look at the Bangladeshis living in Bangladesh, the death rate is really low comparatively. Now, even if we say, right, official figures we don't trust, and even if you increase it by tenfold, say, it's not 44,000, it's 40,000, the population is double in Bangladesh. So they are doing better. But when you look at the Bangladesh situation, the people who are dying and suffering from it tend to be the richer people, the upper middle classes, the poor people living in slums, etc. And I have contacts with them. There are hardly any illnesses or any deaths or suffering. The richer people who has got these chronic illnesses, because their lifestyle, etc., is probably compared to the Western lifestyle, and they are suffering and they are dying because they have underlying heart disease, diabetes, liver problem, etc. But these poor people, they are exposed to different illnesses. They hardly get any treatment, and their immune system, I think, is far robust to tackle all these viruses. And similarly, if you look at the villages, there are many, many villages where there is hardly any disease at all. No one is positive. Only people sometimes traveling from West, like it has happened in Bangladesh, a group of people from Italy went back to Bangladesh because Italy was in lockdown.
Yeah.
And unfortunately, they have spread it to their villages and relatives, etc. So yes, Bangladesh, if you look at it, same in Pakistan. The rate is low. I think the people are resilient. And I think the lifestyle has got to do a lot, because the richer people's lifestyle is like Western lifestyle. They hardly walk. They're door to door in a car. They're in air-conditioned offices and houses. They're on rich food. They're probably smoking and drinking. So if you look at all these things, I guess that's what the reason is. And the BAME community, Bangladeshi community living in UK, are probably rich people.
Sorry, I can't hear you.
Sorry, Dr. Musharraf, can you hear us? I think we are struggling to hear you.
Yeah.
Okay, right. Okay. Well, that kind of justifies it, but again, I'm going to come back to the report again. That report has been widely used by the media. And in my opinion, I don't know whether you will agree or not, in my opinion, I feel in a way the media has kind of like abused it in such a way that is actually spreading fear, scaremongering, and putting the BAME community at an edge. I'm going to ask, actually, Councillor Ahmed, I'm going to ask you, obviously you are in the heart of the community. Do you feel it has that impact? So instead of doing good, has it done something bad for us?
Well, of course it has, to be honest. I think if you remember, a Conservative MP recently kind of prompted widespread condemnation after saying that the vast majority of those kind of breaking lockdown rules are from the BAME communities.
Yeah.
And he suggested, particularly BAME people, particularly Muslims, were not taking the coronavirus pandemic seriously enough.
Yeah. Well, not only
despite the comments, I mean, were kind of widely criticised as them being kind of disgraceful and kind of overt racism. One problem with that particular MP, I think it was Mr. Whitaker's thesis, is that there is no credible explanation as to why British Muslims wouldn't take social distancing as seriously as any other group of British citizens.
Sorry, Mr. Ahmed, I'll actually quote. What he said was, Muslim, BAME, Asian and immigrant population are not taking this seriously. That is outright racist comment.
Of course it is. Absolutely. And as I said, the problem with Mr. Whitaker's thesis is that as I said before, there is no credible explanation as to why British Muslims wouldn't take social distancing seriously as any other group of British citizens. Social distancing is being observed throughout much of the world, including in Muslim majority countries, as the haunting but beautiful photos of the Muslims on the Hajj demonstrate. However, so Whitaker is actually making a fascinating claim here that somehow the British Muslims or the BAME community distinct among Britons and Muslims across the world aren't particularly bothered about social distancing.
Exactly, yeah.
We should stop playing the blame game here, but instead try to establish why some people believe that the virus does not pose a risk to them. While it's clear that some people in the BAME community are not exercising social distancing, however, the same applies to the white communities.
Yeah.
I mean, as an example, the Prime Minister's top advisor, Dominic Cummings, broke the rules and then so blatantly lied about it to the nation.
Yeah.
And I mean, just look at the footage from Bournemouth Beach during the recent hot spells right there of hot sunny weather, and see the large number of white people failing to social distance. Social distancing advice, selfishly putting themselves, their families, and other people's at risk. Right? Yeah. Okay. And therefore, those mass gatherings, led Bournemouth, Christchurch, and some of the other councils have declared a major incident. Now, adding to the offence that Mr. Whitaker has caused, he added his divisive remarks on Eid. Right, yeah. Despite the lockdown measures this year, Eid and Hajj were commemorated differently to other years, but they were still celebrated. Now, like any other religions, Muslims have made sacrifices in keeping with their faith. Making sacrifices makes us more compassionate in troubled world. When the data clearly doesn't support the rhetoric is in danger of becoming a poisonous rant, And so, haven't BAME communities suffered enough without now being blamed for its rise? However, I think the government would be, just my comment, the government would be better off reminding everyone that the pandemic is not over and will not be over for many months. Therefore, this message needs reinforcing every day, stressing the importance of taking precaution to minimize people's chances of contracting the virus. So therefore, every person needs to take the pandemic seriously. Every individual must bear his or her part of a shared responsibility. And so maintaining social distance is not a BAME issue. It is a national and global issue.
Yeah. Thank you. Raydan, do you have anything to add to that?
No, like Mr. Ahmed's covered it. Pretty much what everyone from the BAME community is pretty much thinking. I mean, seriously, like, we know there is inequality. We know as BAME community, we suffer from diabetes. This is understood. This is fine. We know this. Yeah. But what we don't know, what I don't appreciate, is connecting the coronavirus to the BAME community, saying we're at higher risk. I mean, like Boris Johnson said, he said that this virus does not choose who it infects. It infects everyone.
Can I stop you there, Raydan? On this report, page 4, and correct me if I don't understand it properly. The executive summary, the first line, is said there is a clear evidence that COVID-19 does not affect all population groups equally. So if Boris Johnson says that, that's their own finding. Said otherwise. So what's he trying to insinuate? The BAME community are at fault?
This is exactly what my point is with this report. This report is, in my opinion, a very lazy report. Without providing any conclusive evidence, they've decided to publish this report, and from the person from the untrained eye who doesn't understand the BAME community will naturally think that we are causing the virus. And they will naturally, this is just from the common person, from the average Joe, just reading from Mr. Whitaker what he said, they will agree with him because public health have supported it without providing any conclusive evidence. And that's what will promote hatred, and that's what will promote like more trouble in the community.
Yeah, but they publish these findings on the best interest of the BAME community. Do you agree with that?
No, not at all.
Why not?
You can't say that we are to blame. I mean, you're saying that we technically you're trying to say we are to be blamed for the coronavirus. And but yes, we agree about structure, racism, and yes, we agree there's inequalities, but
Okay.
it
Right.
just does not promote.
I mean, are you saying that they are claiming to be to conduct this report on the best interest of the BAME community, but in discreet they are causing more harm than the best interest? Is that what you're saying?
Yes, indirectly trying to blame the BAME. 100%. I totally agree with that.
Dr. Musharraf, what's your view on that?
I think it's given the politicians and the press to spin this news and the report in their own way. It's like a smoke screen covering all the injustice and the wrong that they have done in the past, which has put the community in this. And this is the community. If you look at the initial all those photographs they were putting on the television screens, all the doctors and nurses and frontline workers that are dying, they're basically BAME people. So, they have made the sacrifice. They were not protected initially. I know for a fact, people working in the front line in hospitals were not given PPE. They were told that, oh no, you're not a high risk person because you work in an outpatient clinic, you're not in intensive care, etc., etc. And people have, suffered, and a lot of families have suffered. So we have taken the brunt of it initially, and then on top of that, you blame these people, and you produce a report which is, to cover up your failures, basically.
Yes.
Councillor Ahmed, did you want to say that?
Yeah, sorry. Yeah, I just wanted to say, any scapegoating, would be erroneous, unfair, and only satisfies those who seek to divide us locally and nationally, right? Yeah. And we have to remember, coronavirus had arrived against a background of a very anti-immigrant, kind of anti-BAME public debate. So as the government prepared for Brexit with the legacy of the Windrush scandal still prominent. So, during uncertain times, I think sometimes perhaps we start kind of developing or people start developing simplistic explanations of very complex human processes. So as anxiety, fear, and kind of anger become part of our everyday, I'm rather upset really that instead of trying to identify the cause of high death rates, some individuals are politicizing these issues for their vested interest. In reality, this pandemic has laid bare the inequalities that I mentioned before that exist in our society and the inadequacy of our welfare state net. And we can only survive and overcome the challenges that this pandemic has imposed on us only by remaining united and helping each other. However, we live in an unequal world. And let's not forget, the Black Lives Matter movement has highlighted numerous stories about uncertainty, discrimination, and barriers. We are all not in the same boat. So this pandemic has hit the community, the BAME community, the hardest economically, socially, and health-wise, right? Yeah. The people who are blaming the BAME community also forget, as Dr. Hussain said, that a large number of key workers come from that group, including doctors, nurses, working in the NHS, and these people have sacrificed a lot. So, what this demonstrates is how COVID-19 crisis has been used to create others of Muslims, right? Yeah, of being, blaming them for the spread of the virus and the extent to which the spread of kind of fake news online is contributing to this really extremely kind of worrying trend, right? Yeah, so it raises some very serious questions for me, as to
should be addressed because in order
to
further. Can I ask one? I've got another question. Okay, we obviously like the MP kind of suggested or accused us of not taking this matter seriously. I'd like to come to our community. How serious do you think, i.e. the mosques, how seriously do you think they are taking this issue? In order to sort of understand what we are doing. I'll give you an example. My local mosques, they are listening to the government. They are listening to the guidelines. They are translating, interpreting so that people understand. In your opinion, is our community sort of disregarding these government guidelines? Councillor, I'm going to go to that to you.
Yeah, no, absolutely. I mean, I can only speak for Bradford, where I reside here. Yeah, and so from very day one, the Bradford Council for Mosques made very clear to all the mosques in Bradford that they was going to go into a lockdown and there were going to be no congregational prayers. They observed the lockdown rules very strictly. There were no mosques open, even throughout the period of Ramadan and Eid as well, right? Yeah, okay. So I personally haven't witnessed any kind of breaches of lockdown, right? Yeah, by the mosques, right? Yeah, here locally, right? Yeah. However, what I can't say, and I can't kind of, confirm that perhaps people in small numbers were gathering in their homes, for congregational prayers. But however, on the whole, I think the majority of the people actually, I can say this, that more people from the BAME communities actually, observed the lockdown than from what I witnessed from their white counterparts.
Yeah. Dr. Musharraf, what's your view? What was the situation in Rochdale?
I think it's same here. I mean, all the mosques where there are 15 mosques, they're all closed for 3-4 months. We didn't have any Ramadan, Tarawih prayer or Eid prayer, etc. They only opened when they were allowed to. And the mosque I go to, there are clearly distinct marks where you can put your jainamas. So there is a one person's gap, which is over a meter gap. You take your own jainamas, you take a bag for your shoes, you must wear a mask. And I feel initially I was really worried that shall I go to the mosque or not? But once I went, I was really reassured. They're taking everybody's telephone number, so in case there is a case there, they're making, instead of one Jama, they're doing 2, so that on Jummah there is not too many people. So I go to the second one, and people are maintaining the space. It is a routine now for the people attending the mosque. They just go and then follow the rules.
Okay. Even with lack of education, the guidelines, they do take their time to understand the issue and comply with it. Am I right in saying that?
No, I totally agree with this. Basically, even our local mosque, even before the lockdown, they took it very serious. They found all elderly people over the age of 50 to 70 not to attend the mosque. Because they are at high risk. So before even the lockdown was implemented, we knew that elderly people are more at high risk. So the mosque took action and advised all elderly people not to attend the mosque and read from home. And even when the lockdown was implemented, they took serious action. They closed the mosque and advised people, until further notice, you can't attend the mosque. And everyone took it serious. You go down to Bury Park, where our local area, which is a majority of an Asian shopping area, everyone has a mosque. Everyone takes this very serious. Yes, they may be overcrowding, but they try and maintain the social distancing as much as they can. So that's why I feel like this report is unjustified. And it's just a very lazy report. And that's spreading racial tension between others. That's my opinion on that.
Okay. Rajan, I've got a question for you. Young people, do you think young people are disregarding this guidance? I know you've talked about the elderly in the community. What about the young people? Are they doing it?
Okay, in general, I think younger people at the beginning took this virus not very serious. They didn't take it serious. They thought that that is not from the Asian community. That's just from all communities. They thought that the virus, because far the message was clear, it was only affecting elderly people. So they did not take the social distancing very serious, and they were going out and everything like that.
But because the government wasn't clear on their guidelines?
Yes, it wasn't clear. Like apart from I mean, in my old, I think my previous workplace, this was before the lockdown. They did not take it serious. They advised us like, catch it, bin it, kill it. Use a tissue, and you won't get the coronavirus. This was the advice that was given from HR. So they did not take the virus serious. Businesses didn't take the virus serious. Neither did young people. But once the peak came, and when they actually realized, hold on a minute, it's not just us who think we might catch the virus and spread it to our family members, and that was what their biggest fear. So that's when they started to take it a lot more serious and maintain the social distancing. I think it was more of the fear of being a, let's say, a walking weapon. If you've got elderly family, you are a walking weapon. So that's when they decided to take it serious. But at the beginning, on the government advice, it wasn't as serious as everyone thought it was. But
we have to remember that it took 3 months for this government to take these
exactly.
seriously. Yeah, you know. So what it highlights is
everyone was flying in and out as well.
competencies, right? Yeah, you know, the sheer incompetency of this government, right? Yeah, okay, to give any clear messaging to the communities, which, you know, really kind of, you know, raises concerns for me, you know. And it's almost even now with you know 6-7 months into this kind of pandemic, that it seems that this government seems to make up policies just as it goes along. You know, we have a situation here in Bradford where we have some wards that are on lockdown, but not others. We have situations where, you know, where the wards are kind of, you know, geographically divided, where on one side of the street people can be normal, they can have visitors, they can have families come round, but not on the other side, right? Yeah. Now, this causes complete and utter confusion amongst people and the communities because of the clear lack of any kind of clarity from this government. And so, therefore, I think, you know, to kind of singly point the fingers at particular communities to say that they're actually not observing lockdown rules is just absolutely ludicrous
Yes.
and racist.
Yes.
Okay, yeah. Right. Okay. Is it? I mean, first of all, they are actually, you know, well, using, in your opinion, the blame game. However, their chief advisor breached the lockdown, and the prime minister did nothing. He supported him instead, saying, "Oh, because he's obviously more compassionate towards his parents." That is a very lame excuse.
Did he not? Did he not ease the lockdown after that? After the fiasco, wasn't it a week later they eased the lockdown so everyone can a cigarette come out? They stopped the lockdown and said you can have up to about 4 people.
Was it to cover his track, or just to talk about his chief advisor? And
exactly.
right. Okay. Now I'm going to come back to, again. I've had a few questions from parents as well. I've had a mother actually who wants me to ask the panel or my guests that, or for your opinion. She said, since all this fiasco with the media and blaming, these deaths in a nice way, yes, because of the finding of the government. However, now the school started. I'm at an edge when I'm actually going. I'm at an edge when I'm actually traveling. I feel like people are looking at me. I'm always kind of like, walking around or traveling in fear. I can't even go out without thinking, is somebody saying that because I come from that? Isn't that sort of more mental, Dr. Musharraf, what's your opinion? Isn't that causing more anxiety and mental health issues as a result of this government lazy, as Rejan said, report? What's your opinion?
Obviously, already, people are anxious and worried, and this sort of labeling and this sort of blame game doesn't help anybody's mental health.
Thank you.
And people are initially when I was going out after probably 4 months, I was the only one wearing mask in the supermarket.
Okay.
And then people are looking at, so I had to take it off. You are feeling the odd one out, and all these people, white people, they are roaming around and shopping, etc.
They're immune to it.
So I thought, no, we have to be careful. And obviously, since then, the government has implemented. But initially, people were not taking it seriously. The counter, the operators, they were not taking any precautions, etc.
And it is not the
Our
BAME.
people, I think what we need to do is use our common sense.
Mm,
Doesn't matter what other people think, whether they're looking at it. First
okay,
of all, we should be selfish here, look after ourselves,
okay,
wear the mask, keep the distance, wash our hand, improve our lifestyle, get rid of if we smoke and, if our lifestyle is not right, I think we should change.
mm,
We should exercise. Nobody's going to help us. And you don't expect from this government. This is the worst government I have ever probably seen in 40, 45 years of my stay in this country.
okay.
And most incompetent ministers they have produced. And, I was just saying recently, they even had to get the former Prime Minister of
Mm,
Australia to negotiate for them. There is such a lack of talent in this country. So they
um,
can't find somebody here to, do things for them. So I don't think we can rely on any of these services. We need to look after ourselves, and the expertise that we have in the community, we should put together. We
okay,
should, challenge these abuse and rise, to this challenge and
okay,
help each other. And I think, like Ishtiaq, Ahmed, and Razan working in the community,
yeah,
they will know, I think, this is the time we take action because we have been, shouting and screaming
yeah, yeah.
discrimination and racism, and nothing's been done. I think
Okay, we're
it's time
suffering
that
in
we take
silence, rather.
things in our own hand.
Okay. Now, in terms of we should challenge this. I'll come back to you on that one. But in terms of this report and this use of this report, which is widely used by the media, isn't that causing friction? I mean, it is causing friction, obviously, from our discussion. But isn't the government winning in their conquest of divide and conquer? Should we not be doing more, though? Ishtiaq, as we
Yeah, I think, yeah, absolutely. The hostile environment constructed as a result of years of kind of vilification of migrant workers and BAME communities, including asylum seekers, by the press, demonized by politicians eager to pick up some cheap votes for the
Mm,
social and kind of economic sins in our society, are forced to work in the midst of this crisis. However, I think we've had countless inquiries with many recommendations that, if implemented, would have improved the situation. Now, that is not to say that the situation should not be assessed or
mm,
action taken. It is desperately needed, but wherever it is done needs to address the wider social, economic, and political factors that have left the BAME community so vulnerable during
mm,
this pandemic. So, if these factors are not addressed, then what becomes common currency is the idea of BAME people are at higher risk of coronavirus because simply they are BAME. The institutional and structural racism that has placed BAME workers in this vulnerable position will be
mm,
ignored. Racial discrimination will increase, and BAME workers will continue to die because of a continued refusal to accept the consequences of racism in our society and a refusal to act to eradicate it. Of course, what we can say is that the government wants an insurance policy. If
mm.
we end up with a second spike of infections, and that will involve blaming the public, and in this case, British Muslims or the BAME community, so therefore we should be clear that the evidence doesn't actually support that claim.
Is that correct, Rejan? What's your view on that? What Ishtiaq has to
I
say?
completely support what Ishtiaq said. I completely agree with him about the structure and racism that there is. But my problem is again, like they said, that it's not necessarily your ethnicity that will cause the virus. It's the fact that we are working front line and we are putting our lives at risk. So regardless of race or anything, we are at front line. So that is the main reason of risk, not because of ethnicity, not because of where we're from, because we don't have any conclusive evidence. So without providing any conclusive evidence, this report, in my honest opinion, is rubbish. It's rubbish and it spreads racial tension between all the ethnicity. If you want to publish that report, come back with a conclusive evidence that shows and proves that it does affect a different, different ethnicities. But apart from that, just stop it. Stop.
What should we do about it? Dr. Musharraf, what should we do about this? Well, first of all, actually, my question is, we are, like Rejan, or everybody actually agrees that our frontline workers, our health workers, our care workers, our GPs, our hospital doctors, everybody, we are putting our neck on the line to save everybody, including the white counterparts. Okay, but now we are being penalized because we're dying as a result of trying to save others. Now, should we stop being the frontline workers? Dr. Musharraf?
No, I think we need to counter this report with our own report.
Okay.
That's what I was saying, that we have enough people in different areas of work and different expertise.
Okay.
We can gather the evidence. Even if you look at BMA, British Medical Association, Chairman Chan Nagpal is a BAME. So, BMA can organize a report, including the communities, gather the evidence and counter this report, because again they will say you don't have any evidence.
Right.
So this is what I'm saying is, rise up to this challenge, be constructive, gather our own evidence and publish a report, authentic report with expertise. These are the people who are working in the NHS or social care and frontline, who are in powerful and positions, and their weight will count. Because if they say this is the study we have done, this is the evidence, this is our report.
Okay.
This is how I think we need to challenge the establishment.
Ishtiaq, obviously, Dr. Musharraf has given us a very important point. As a councillor, as a former politician, or even if you're in the community, how do we go about doing this? How do we go about challenging this report?
Well, I think this raises, an important issue, and the issue is, where are our BAME politicians on this, and where do they sit on this situation? Because I've heard very little from them, locally here in Bradford or nationally. And despite Bradford Council having a third of the councillors from a BAME background, I've not had a single, counter narrative that's been put out there by this very right-wing corporate-owned media in this country, right? Yeah, okay. And yet very little challenges to the rhetoric that's been put out there. So that raises a question as to, in terms of our leadership, the BAME leadership that we have in this country, how impactful are they? How effective are they? Where's the counter narrative, as I said before, from them? So perhaps as a community, we also need to look within to see how we can build more robust leadership, right? Yeah, within our communities. Because from my experience, and I'm going to be quite controversial here, we have very little input into any decision making, despite having high numbers of representation, right? Yeah, okay. Or, either on the scrutiny committees or either on the appropriate kind of council committees, but yet we have very little input into decision making. What does that tell us? It raises questions in terms of how effective are our politicians, and when we're in looking in terms of our kind of voting behavior, are we voting for the right individuals who will make the right representation? Unfortunately, we are not.
Right. Okay. Rejan, do you have anything to add to that?
No, I mean, pretty much it's just covered everything what I was thinking. It speaks for everyone, and this is exactly what I was thinking. Is we lack leadership. We lack people in position of power, and there's nothing unless that changes. Nothing will change. Nothing will change.
So basically, our community leaders, our councillors, our local MPs, we need to be able to do something more in order to create this chain reaction of betterment. Unless they stand up and represent the people for the people, then we are not going to achieve anything. It is, we voted for them and we expect them. They are obliged to do their best in order to actually safeguard our best interest. And at the moment, they're not doing that. And we're urging the community leaders and the councillors and everyone else, like in the political level, to help, in order to be able to support the BAME group and challenge these and create that chain reaction of betterment. Is that everybody's view on that.
Yes, agreed.
Right. Okay. We have come to the end of our show. Thank you very much for everybody for your input. It's been a valuable, informative topic today, and I am hoping my viewers at home will actually take this into consideration and speak to their local councillors, their leaders, and everyone else, and let us work together to create that betterment. Because the only way we can do this, achieve the best things, are to unite. And again, thank you very much. We have come to the end of the show. Thank you very much, Ishtiaq.
Thank you very much.
And Rayjan. Thank you very much. Sadly, we've come to the end of the show. Thank you. Have a good evening, everyone.